Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Updates on State COVID-19 Legislation. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator with the Hawaii Public Health Institute. Before we get started, there's some Zoom housekeeping we'd like to go over. For all questions, please utilize the chat box or Q&A box located at the bottom of your screen. We are not offering any continuing education credits through this webinar series. And lastly, all webinars are recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, it's my honor to introduce you to our presenter today. Representative Linda Ichiyama represents the 32nd House District, including Moanalua, Salt Lake, and Aliamanu, where she was born and raised. Elected to office in 2010, she currently serves as the chair on the Pandemic and Disaster Preparedness Committee. In addition, she serves on the Committee on Government Reform and the Committee on Judiciary and Hawaiian Affairs. She is also one of 4 co-conveners of the bipartisan Women's Legislative Caucus. Representative Ichiyama is a graduate of Moanalua High School, Georgetown University, and the William S. Richardson School of Law at the University of Hawaii at Manoa. She has been active in the community through a number of organizations, including the Hawaii JCs, the Moanalua Lions Club, the Japanese American Citizens League, and the Honolulu Community Action Program. Without further ado, I'd like to turn it over to Representative Ichiyama.
Thank you very much, Steph. Thank you also to Jessica Yamauchi for asking me to be part of your webinar series. I really appreciate the opportunity to speak with all of you today. So I have a quick presentation. Let's see. And I'll share my screen, and then I purposely kept my presentation short so that we could have a lot of time for questions and answers, and hope to have a good dialogue. So please feel free by all means to put your questions in the chat or the Q&A as we go along. Is everybody able to see my screen? Okay.
Looks good.
Okay, thanks. So I'll just get started by sharing a little bit about myself. I am a mom of 2 kids. I have a son, Dylan, and a daughter, Emily, and they love to go to the zoo now that the zoo's reopened, thank goodness. We do a lot of that and going to the beach. I also wanted to share some pictures of my pandemic hobbies. I think that everybody during the lockdown found new ways to entertain themselves. So I learned how to bake bread, and I made chili, and I also tried to find new ways to get my children to eat yogurt in the morning. The sprinkles were very helpful. Finally, I just wanted to say that I am very passionate about women's issues. And so I know this is primarily a webinar about the new Pandemic and Disaster Preparedness Committee. But if anybody wants to ask questions about the Women's Legislative Caucus, I worked extensively on issues regarding Title IX, sexual assault evidence kits, also worked on women's health in various aspects. And last year, which is why I have this sash on, was the 100th anniversary of women's suffrage in the United States. So we didn't get to celebrate it as much as we would have wanted to, but I still think it's an important reminder of it wasn't that long ago when women did not have the right to have an equal voice in politics. So I'm very happy to see lots of women on today's webinar. So moving right along, here's a brief summary of what I'd like to cover today. First is to share with all of you what the Pandemic and Disaster Preparedness Committee is about, what we've been working on. This is a brand new committee that was formed last November, partly in response to the current pandemic, but also to kind of take a more holistic look at how we respond to disasters as state government overall. Next, I'd like to share with you some of the bills that the committee has been looking at and working on, and then talk a little bit about the legislative process and share some ways that you can get involved in the legislature. Even though our state capitol is closed, we have remote hearings, And so I'd like to give a couple updates on that. And then I would just wrap up with a few COVID-19 updates. Since we are the pandemic committee, we've been having regular informational briefings with the Senate Committee on Health and with Dr. Libby Char about vaccine distribution, testing, contact tracing. And so I wanted to share some of those updates. So first, the House Committee on Pandemic and Disaster Preparedness, or PDP. We are a brand new committee, and basically the key question that we are trying to look at this session is, how can state government better respond to pandemics and other disasters? So I don't necessarily think that this question has to be answered through legislation, but the committee, and you see the list of members here, myself and the vice chair have been meeting with various agencies, HIPHI, stakeholder groups, and a lot of good questions have been asked about, what about language access? What about people with disabilities? Or, how are we making sure that we have clear and consistent communication, which has been, I think, one of our greatest challenges during this pandemic, is getting a consistent, clear message across to everybody who needs to hear it. And so often that message changes day to day, but we still need everybody to get the most up-to-date information. So this is something that the committee will continue to work on through session, as well as during this coming interim and into next session. And I would definitely welcome any feedback during the Q&A if you see areas that we should look at, or areas of improvement, or gaps that you've seen in your own experiences or in your own community. So here are some of the issues that we've been working on in the first half of the legislature. The first is this discussion that's happening really across the country, is the authority of governors to declare and maintain a state of emergency for an extended period of time. I think we're on our 18th proclamation. And there was litigation about this very early on in the pandemic. And so we wanted to provide some clarity around the ability of the governor to declare a state of emergency and to continue that proclamation for a long period of time, as well as provide some legislative checks and balances. And then there's another discussion that we're having about state versus county authority during an emergency. And these bills are a discussion around, should there be uniform travel policies? Should there be uniform essential worker policies? Because we're an island state and we're so isolated in the middle of the Pacific, we really have a strong interdependency upon each other. And making sure that we have consistent policies is also important to our economic recovery. We considered a bill to put into session law a face mask mandate. And that bill was a little controversial, so I'm not sure if it's going to make it, but it was a good discussion that we had about, who and in what circumstances are you required to wear a mask, and how long should it take effect? And so I think that was very helpful. Another bill that's coming over from the Senate that we've been working on is changing up the penalties under HRS 127A. So that's our emergency, basically emergency power statute, the ability of the governor or the mayor to declare a state of emergency and issue emergency orders. Under the current chapter, the penalty for violating an emergency order is a full misdemeanor. So that means up to a year of jail time. And that's the only penalty, that's it. And really, I think when we wrote 127A, it was like natural disasters in mind. If you are conducting lava tours and taking people too close to lava, you should be subject to a pretty serious criminal penalty. But we never envisioned having to deal with situations where people are not wearing their masks or not properly following the social gathering guidelines, which really shouldn't rise to the level of a full misdemeanor, but maybe it should be something more like a violation or infraction. And we could treat it similar to a traffic ticket that everybody's familiar with, where you get the yellow slip and you pay it online and you're just done with it there without ever having to show up in court. So this is an important one to create more varied penalties under our emergency chapter. And then in the emergency order, the governor or the mayor would be able to specify okay, if you're violating the face mask, it's, like a $50 or $100 fine or penalty, and create a varied level of consequences for any type of violations of the emergency order. Then finally on this page is a discussion about, what is the right organizational structure for our emergency response agency. Currently, it sits under the Department of Defense, and the administrator of HIPHI reports to the Director of Department of Defense, which is Major General Hara, who actually also is the incident commander. But, at the very beginning of the pandemic, there was a lot of confusion among state agencies, and having a cabinet level position in HIPHI and having that broader coordination, I think could be very helpful. So we wanted to have that discussion as creating HIPHI as an attached agency versus as within and under the Department of Defense. And here's a few more that I thought might be interesting for the healthcare folks on today's webinar. There was a bill to propose civil and criminal immunity for healthcare providers during emergency situation, as long as they met certain crisis standards. I'm not sure if this bill is moving forward or not. We have a deadline coming up this week, so I think it's still technically live, but we're waiting to see. But this is, I think, a really important discussion to have about when you're in a pandemic. You have to triage, right? There is a time when our hospitals, we're looking at 300 new patients a day. You have to stop elective procedures, and what kind of immunities should we or can we provide for healthcare providers and facilities that have to make these really tough calls during a pandemic or other emergency situation. There are also a number of bills relating to telehealth. One of them would clarify that a phone call, no video, just a regular normal dialing on the phone call can be considered telehealth, may not be reimbursed at the same rate as a video conference, but can still be considered telehealth. Another bill was to clarify that a telehealth relationship can be established via telehealth. You don't have to start out seeing your primary care doctor in person and then transition to telehealth, but just to clarify that you can establish a telehealth relationship up front. These last two bills, the HB 934 deals with appropriations for COVID-19 response. So we're still making sure and looking at the needs of our Department of Health, Department of Defense to maintain the Safe Travels program, to fund contact tracing. We're hopeful that the federal government will pass some sort of stimulus package within the next few weeks, but we're still watching that very closely to see whether or not aid for state and local governments will be included. And then finally, looking at programs for COVID-19 recovery and relief. And the one example I have here, HB 1324, is a commercial rent relief program to help commercial tenants to enter into an agreement with their landlord for rent relief. Okay, so now that you know all of the bills that are being discussed, and you could be tracking some of your own already, how do I get involved in the legislative process? And there's a whole varied spectrum. You can be as involved as you want or not involved as you want. I always encourage people to start off by contacting the representative. And your district representative, your district senator is always interested in what you have to say, as they are responsible to you. They are held accountable to you as because you're their constituent. So if you are interested in a particular bill or issue, I encourage you to start off by contacting your legislator, your representative or senator. So you can call them, you can email them, you can ask for a response back. Some people call me and they just want to share their thoughts and they don't ask for a call back, but I'm more than happy to reply with my thoughts. You can also ask for meetings with the legislator. A lot of us are doing meetings virtually, which actually is kind of convenient because then you don't have to come down and drive and find parking and feed the meters. So that's been very helpful. Other ways that you can be involved is through the Capitol website. You can sign up to receive alerts, but first you have to create an account. And I'll share screen and show you how to do that. You sign up to receive alerts on a particular bill that you're issued. You also, after you create an account, can submit testimony on a particular measure, support, oppose, amendments. I just note that because of the way we are processing a testimony, it's really important to get it in on time. And that means 24 hours in advance of the hearing. So if you have a hearing on Tuesday at 2 o'clock, you need to get in your testimony by Monday at 2 o'clock, 24 hours in advance of the Tuesday hearing, in order to ensure that it's considered. Testimony that's submitted late may or may not be considered by the committee, just because of the amount of time it takes to put together our packets and allow the members a chance to review it before they actually vote in the hearing. You can also participate via Zoom in our hearings. Because the Capitol is currently closed, all of our hearings are broadcast on YouTube, and you can watch them live, or they're recorded in perpetuity, and you can sit down and watch them at your convenience. You can watch all of them, none of them. You can skip to the end if you just want to find out, okay, what did they do in this bill or that bill? And you don't have to listen to all of the other bills and just the one that you're interested in. So I personally have found that very, very helpful as I'm tracking bills. But if you want to sign up to orally testify, after you submit your written testimony, you have to check off a box that says, I'm interested in submitting oral testimony or via Zoom. And then prior to the hearing, you'll get a link in your account that will say Zoom link, and then you can click on it and you'll be allowed into the Zoom room. And you have to then wait for the chair to call you, and they'll be working off of the testimony list of who've submitted testimony and who signed up to testify via Zoom. They'll call your name. You can offer your verbal comments. And it's been great to have this opportunity, because for the very first time, we're seeing a lot of regular participation from the neighbor islands. I would say normally it's rare for us to get somebody to fly over from Maui or Kauai, Hawaii Island, because they have to take time off of work. You know, they've got to rent a car, drive here. If it's a morning hearing, they have to fly over the night before. So it's a 2-day trip. But now that it's remote testimony, we see people testifying from their house, from their farm. We have people testifying while they're driving. I've seen a couple of people, but it really does make it very accessible. And I would also say that it's helpful to hear directly from people if you're comfortable testifying orally, because then we can also ask questions. And that's an important part of the process, so that we as decision makers can learn more about this issue and educate ourselves and make sure that we're making a well-informed decision. So I will stop sharing this slideshow for a minute, and I will bring up the Capitol website. I hope you all can see this okay. So if you're interested in a particular bill or issue, the easiest way is to go to this search box here, and you can just type in any bill and the bill number is. And this is just an example of a bill that moved through the pandemic committee. You'll be able to see the most recent version of the bill here. You'll see all versions, prior versions, the original, the House Draft 1, read all the committee reports. You can also read all the testimony. And when a bill is scheduled for hearing, this will populate shortly after the hearing begins. You can also look at all of the hearing notices, watch the hearings themselves. This will tell you a description of what the bill does, the committee referrals, and who are the introducers. And this is also very helpful, the status of the bill. So where is it? What did the last committee do? How did people vote on it? And this will also tell you whether or not the bill is dead or alive, depending upon where it is in session and the deadlines that are coming up. Let's see. Here, if you go back to the Capitol, so you can register. Very easy to create a user account. You're just your name. If you have an organization, you want to put it in your phone. You don't even need your phone number, but just name your email address and you create a password. And then once you create your account, then you can log in, track bills, submit testimony, and all of that good stuff. And the last thing I wanted to show you is how to find your legislator. A lot of people don't know who their legislators are. And like I mentioned at the beginning, that's really the best person to reach out to. So you can put in your address. So I'll just put in the Capitol address. And then you can find your legislator. 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 And then you can find your legislator You can see it's in Senate District Carl Rhodes. And he'll have his picture. You can see who he is, email, phone number. And House District is Speaker Psyche. Picture, phone number. And this is just a really easy way to find out who is your legislator. Okay, and then I will go back to the presentation. Then finally, the last thought I would leave you with is that if you ever need help, the public access room is a great resource. They are available to take your phone call, answer your questions. If you're having trouble with the website, you're not sure if a bill is alive or dead, how do I find my bill? They are very helpful and a great resource. So I encourage you to visit their website or call their office if you have any questions. So then kind of to wrap up, I wanted to share a few updates about some of the resources that are available. I always refer people to hawaiicovid19.com if you have questions about vaccination, about what to do. If you've been in contact with somebody who's tested positive for COVID-19, they also have FAQs in multiple languages. And I think that Department of Health actually has done a really good job in translating to, I think, something like 25 or 26 different languages, vaccine FAQs to help folks read in their own native language and get the information that they need to make an informed decision. We just had an informational briefing on vaccine distribution. This was our third. We've been having them since, let's see, December, January, February. And the most recent information that they shared was that the federal retail pharmacy program is up and running. So there are 10 Longs locations statewide that are currently open and accepting appointments for Kupuna 75 and older to receive their vaccine in their own community. And it's my understanding they have open appointments. So if you know somebody who's been trying to get an appointment, please encourage them to visit the CVS website. They also have a 1-800 number that you can call to make an appointment if you're not able to get online. The other announcement that's come out recently is that they'll be moving to increase the number of kupuna that are eligible to 70 and older. They're looking at being able to make that official mid-March. There's just, I think they're being conservative on saying when they'll be able to open to it because of the delay in shipment that we had from the ice storms a couple weeks ago, or was it just last week? I'm losing track of the weeks, but the ice storms in the mainland that delayed our shipments. And so we missed some shipments, and that means we had to cancel a bunch of appointments. Some people who were waiting for their second dose were not able to get it. So they're playing a little bit of catch up, make sure that everybody who was scheduled has been able to reschedule and get their second dose on time, and then they'll be able to open up to those 70 and older. They also have really great resources on the Hawaii Department of Health website, also on the Hawaii COVID-19 website on tracking the vaccine distribution and supply. They have it broken out by county. You can tell how many doses we have been allocated, which is how much the federal government has said we will receive, how many doses we've actually received physically in state and been shipped to us, and then how many doses have been administered. And it's a very helpful tracking tool. And finally, I always try to promote the Aloha Safe Alert app. This is an app that was developed in partnership between AIO and the Department of Health. It is the state's official exposure notification app. And the way it works is that it uses low energy Bluetooth on your phone to track if you are close to other phones, close contact, which means 6 feet or less over 15 minutes. And so it exchanges this long alphanumeric anonymous code with the other phone, and it keeps track of this data for 2 weeks, 14 days. So let's say, for example, you have the app on your phone, you're going about your normal life, and then you come down with a cold, you get tested, you realize that it's COVID, you find out it's COVID. The Department of Health, once they get your positive test result and it's confirmed, they will send you a link, and they will send it to you so that you upload it on your phone on the Aloha Safe Alert app. You put in that link, the app sends an anonymous code to the server. The server then anonymously notifies anybody or any other phone that you've been in close contact with for the past 2 weeks. And it's completely anonymous. The app never asks for your name, doesn't even ask for your email. It does not track your location, but it is a quick way to let people know if they've been exposed to somebody who's tested positive for COVID-19. So I encourage everybody to download the app and to make sure that you have your notifications turned on. And with that, I'm happy to open up to any questions.
Thank you so much for your presentation. Just as a reminder to attendees on the webinar, please feel free to put your questions into the chat box or into the Q&A. So the first question that we have is, aside from the budget, what is the biggest challenge facing our state coming out of the pandemic?
I think that it's actually tied together with the budget, and the biggest challenge is going to be recovery. All of the economists and folks who study how we are doing economically are telling us it's going to be years for us to be able to recover. We may never return to levels of tourism the way that they were in 2019. And so that has a huge impact on how we operate as a state, the jobs, and there is a task force that Governor Ige put together along with Alan Oshima, the state recovery economic navigator, Speaker Psyche, and President Kochi, to come up with a vision and a plan for Hawaii 2.0. And so they're in the very early stages now of starting to try to figure out a process for stakeholder and community input. And they'll be going out this summer to hear community voices and what they think that Hawaii 2.0 could look like, should look like. But I think that recovery is really the biggest challenge in front of us. And how do we live with this new normal? How do we know when the pandemic is over? That's a hard question. And we may not know until we're in hindsight, right? That it's already passed. And then we'll be able to say, oh, okay, on this date, this is when it ended. But we won't know at that time. We'll only know in hindsight.
Thank you. The next question is in relation to evictions. So what is the current policy of the emergency ban on evictions in Hawaii? And there's several parts to this, and so maybe I'll pause there and I'll do the follow-up questions after.
So there's a couple of layers to this. There is the federal eviction moratorium, and then there's a state eviction moratorium. Basically, if you are a tenant and you are not in any type of major breach of your lease, but you, let's say, aren't able to pay rent, and that's the only thing that you haven't been able to do, then you should not be subject to eviction. Now it might be a different story if you're, breaking down the property or, being violent. That's a different story. But if your only failure is that you haven't been able to make rent, then that is not grounds for eviction under the current emergency orders. So if you're in that situation, then I would recommend that you reach out to Office of Consumer Protection in Department of Commerce and Consumer Affairs. They have a lot of tenant resources and they can help you get help.
And you may have already answered this, but you did say it is a state thing. So is there any difference between the counties?
I'm not aware of any county order that prohibits eviction. There could be, and I'm just not aware of it. The ones that I know of are the federal and the state.
Okay. And then lastly, do you know if there are any mortgage relief efforts or support for owners?
Yes. So actually the state rent relief program last year, unfortunately, we ran out of CARES money, was to provide both rent and mortgage help. If you're on the island of Oahu, Honolulu Community Action Program, or HCAP, has a rent mortgage utility relief program. It's called Hale Kako. And if you go on their HCAP website, the flyer is up there. You can call any of their district service centers and apply by calling over the phone, and I think they email you the information and you submit it all via email. but there is that program for Oahu residents.
Thank you. Next question is, are there emergency preparedness plans for the state in relation to food security in development?
I'm not sure I understand the question. Emergency plans for food security, like if we're in a natural disaster, or what are our plans to feed ourselves, or?
Let's see. So I guess, is there a plan being developed just in general if we face another pandemic or we see another surge, I guess just related to COVID, not so much a natural disaster?
Well, I would say that the Hawaii Food Bank and the various food bank nonprofits on each island, I think, have done a very good job of putting themselves out there, organizing mass food drives. I know that there's also been a lot of support for seniors through Meals on Wheels, getting meals delivered, getting groceries delivered. I think that we're in a much better place now than we were last summer, or even spring, when we're in the lockdown and trying to figure out, okay, is it safe to go out to buy food? And now we also actually have specific guidance from CDC that says COVID-19 is not transmitted via food, which is really helpful and good to know. I think that, to me, I think that feeding food side has kind of stabilized in terms of the existing support structures in place. I hope that answers the question.
Yeah, thank you. So there have been several letters to the editor to the newspaper regarding COVID-19 immunizations for those 65 and over, and why they are not being included with the elder group. Do you know what rationale there is for omitting those 65 and older, where we might see other states that are already vaccinating the 65 and up?
Yeah, so every state has had the ability to determine, based on their unique population and risks and vulnerabilities, on how to structure their tier system. I think we are moving in that direction very rapidly to be able to expand to those 65 and older, and we're taking that next step in a couple of weeks by going to the 70 and older. I think the important thing to keep in mind is that we're doing kind of dual tracks in 1B. It's kupuna who are at higher risk of serious complications if they happen to contract COVID-19, but it's also our frontline essential workers, right, who have to report to work and have to be within 6 feet of either coworkers or members of the public. And so trying to get through both of these tracks at the same time it is a huge undertaking. And I think that we need to see more progress being made on the frontline essential workers before we can take that next step to open up to phase 1C, which is the 65 and older.
And sticking with the vaccines, do you have any updates on the Johnson & Johnson vaccine becoming available in Hawaii?
So I'm not sure what our allocation might be. I think the initial round of Johnson & Johnson was like 4 million nationwide. So we may see a few thousand doses, but then there's going to be a lag because they're manufacturing more. They've committed, I think, to making 100 million by this summer. So we're going to see that slowly ramp up, but we're probably going to get an initial round and there's going to be a delay and then we'll get some more.
Thank you. So as our state moves into Tier 3, what is your message to the residents of Hawaii?
I would say to please continue to be vigilant, wear your mask, wash your hands, avoid large gatherings. I worry that there's pandemic fatigue, and understandably people are tired and they want to be able to see their friends and return to their normal activities. And I think we're so close with the vaccine rollout, but we still haven't vaccinated the number of people in our overall population where we're at herd immunity. So it's really important that we maintain those essential sort of foundational safety measures in place to prevent more community spread.
Thank you. So the relationship between the legislature and administration appears to be continuous in the beginning of the pandemic. Do you feel that the relationship has improved, and are you able to work effectively with the Department of Health?
Well, I don't want to speak for any of my colleagues, but I will say for me personally, I continue to work very closely with Dr. Char and her team, also with Administrator Luke Myers at HIPHI and Major General Hara. I feel like we've had a very close working relationship, and we communicate on a number of issues on a regular basis, whether it be the budget, vaccine program implementation and distribution. How do we send a consistent and clear message to the public about for example, the Aloha Safe Alert app or vaccines? So I'm grateful for that relationship, and I think it's been very helpful. I think that, speaking to the original question, I think that there's always going to be tension between the three branches of government, and not just, between the executive and the legislature, but we are meant to be checks and balances on each other. And sometimes that means agreeing to disagree. But at the same time, I think that's what keeps our system in balance. And I think that sometimes it's important to ask those tough questions and make sure that we get answers.
Yes, and I think one of the important things with that is communication, and communication is something you mentioned as a challenge during the pandemic. What strategies has the committee found effective in communicating? And I think this is referring to the PDP committee.
Well, since we're very new and have only been in existence since last November, I think one of our biggest venues has been through the informational briefings that we've been holding with Department of Health. We've gotten really good attendance and participation because they're live streamed on YouTube. And I think that, we have been pushing the department to make more information user-friendly with infographics, making things clear and understandable. I think sometimes they get so caught up in the day-to-day work that they do, they have to remember to translate it in layman's terms and just make it very easy to understand for the rest of us who are not public health workers.
Thank you. So the next question is regarding housing. So do you have any thoughts on what the future of the housing market in Hawaii will look like? A lot of people from the mainland have relocated to Hawaii to work remotely, but post-pandemic, will there be any change or opportunities for Native residents to access more affordable housing?
I think that, pandemic or no pandemic, affordable housing is something that the legislature has been working on for many years. It wasn't that long ago that we put $100 million into the HHFDC, Hawaii Housing Finance and Development Corporation, to build more affordable housing, to build more affordable rentals. And we remain committed to that. I think that, going back to the discussion about Hawaii 2.0, that's a really important discussion to have as we're looking at what is Hawaii going to look like in this new normal, and how do we make sure that our residents are able to afford to live here and stay here and raise a family here.
And going along those lines, is there any discussion or any way that local residents would have first priority to the affordable housing or the housing market?
That's a good question. I think that there are certain requirements, like income requirements. I don't know if it's residency requirements specifically, but there are certain preferences for the projects that HHFDC works on. And they're not luxury towers that they're building, you know, that somebody needs to spend a multi-million dollars on. So they're building for local people. They're building for local families.
Thank you. So we've definitely seen the importance of community health workers throughout the pandemic. Do you know of any legislative bills that community health workers should be aware of?
I think the only one that immediately comes to mind would be the liability bill. Right, if we're in an emergent state of emergency, having a limited amount of immunity for any actions that you have to take in an emergency. Like I said, I'm not exactly sure of the status of that bill yet because we have a deadline coming up, but that's probably one. I can't think of any, maybe the telehealth bills, right? That's, I think, going to affect healthcare. More people are doing tele appointments either on the phone or via video, and we're trying to make sure that we're keeping up with those changes.
Thank you. A couple more questions related to vaccines. So, do you know if any language assistance for vaccination online and via phone are available?
So if you go to the Hawaii COVID19.com website and you click on the vaccine FAQs, they've translated it into a number of different languages to make sure that the information is readily available and people can access it in their native language. I would definitely start there. The Department of Health's Office of Language Access also is a really great resource, and they've been instrumental in making sure that people are able to get the information they need in a particular language.
Great. And next question related to vaccines is Maui seems to be vaccinating a lot less people than Oahu. Do you have any information about vaccinations on Maui?
So this came up in our most recent informational briefing with Dr. Char. She said she's been looking at those numbers very closely, and it was also concerning her that it seemed like Maui was lagging behind the other islands. There are a couple of factors that were involved. One was a delay in inputting the information of people who had been vaccinated. So, right, the Department of Health website shows what's been entered into their database. And if people are being vaccinated, but their information is not entered in the database, then it's not being reflected in those numbers. I think that there's also an ongoing discussion about expanding the pods there and making sure that everybody is using up their supply, that they're not trying to reserve any for second doses because they don't need to, and that more second doses will be coming. And so they're going to ramp up over the next few weeks. I think they're aiming to get something like 6,000 or 7,000 more vaccinations on Maui in the next couple weeks, and I think that should address that gap.
Thank you. So, just a few final questions going back to the legislative process. So, you did mention that things have changed this year and there's a lot more opportunity for Neighbor Island folks to do oral testimony because the hearings are via Zoom. So, do you feel like in the future, remote testimony could continue to allow more people to be a part of the legislative process?
I hope so. I hope so. I think now that we've done it, we have the technology, we've put in the infrastructure, and I have to acknowledge there are still a few kinks in the system that we're working out, and we're all doing this for the first time. But I think that a lot of the hesitation or reservations about doing virtual hearings has kind of, been addressed because we've all done it. So I hope that we'll be able to continue some kind of hybrid in the future.
Awesome. And then has there been any discussions about opening up the Capitol to the public this session?
Unfortunately, none that I'm aware of. A lot of people don't know that the state capitol is actually managed by DAGS, Department of Accounting and General Services. And you have not only the legislature here, but also the governor, lieutenant governor, and their offices in this building. So it's not the legislature alone who gets to decide whether or not to open. It's actually a coordination between the executive and the legislature, as well as DAGS.
Okay, and maybe for our final question, from what you've learned about our state's response to COVID-19 and the pandemic, what do you think is the single most important thing for Hawaii to do now in preparation for another disaster or pandemic?
I really hope that this is a once in a lifetime. I'll just be candid. Um, uh, I I hope that my kids never have to, go through what we've gone through. Um, but I would go back to what I mentioned at the beginning of the discussion is more and better improved communication. Um, we've I think this pandemic really showed us um, how difficult it is to communicate a complicated message on a widespread level consistently. And I think we need to get better and practice our lines of communication for not just pandemics, but any type of disaster. So let me give you an example. Last year, the legislature passed a bill appropriating over $60 million worth of PPE. And this was going to go to help childcare, schools, small businesses, hospitals, and independent medical providers. And we had to start from scratch. How do we communicate with all these groups? How do we tell them this PPE is available? How do we make sure that it's available in multiple languages? And how do we make sure if they can't access it online, that they can do it via phone, and that level and that type of communication we've never had to do before. So we relied really heavily on the Chamber of Commerce. We relied really heavily on our community partners. For the foster care homes, we relied on their networks. AARP helped us, but it was having to start from scratch. How do we build out this infrastructure to communicate free PPE? Please let us know what you need, and the state will provide it for you. So I think that's been one of my biggest lessons and takeaways is we need to practice our communication during disasters.
Thank you so much. Any last minute thoughts that you'd like to leave with our attendees today?
Not that I saw one question in the chat about the exposure notification. So that is the Aloha Safe Alert app. You know what? I'll see if I can bring it up on my phone and I'll show you what it looks like. You can go to the Google Store or the Apple Store, and I don't know if you can see it, but this is what it looks like. That's your dashboard. And it has the COVID numbers, and it's free and it's completely anonymous.
Awesome, thank you. Well, I want to give a big mahalo to you for joining us today. I also want to thank all of our attendees via Zoom for joining us, and thank the HIPHI staff behind the scenes for helping this run smoothly. I'd like to let everyone know to please save the date of April 7th for our next public health action webinar, and we will share details as we get closer to that date. Again, thank you so much for joining us today. Be safe, be well, and we hope to see you on a future webinar. Aloha.
Thank you so much. Take care.